Let's now go to a section of your module with serial key of House Baratheon-241. Let's proceed. Number 1. 43-year-old client with blunt chest trauma from vehicular accident has sinus tachycardia, is hypotensive, and has developed muffled heart sound. There are no obvious signs of bleeding. Which of the following condition is suspected? Now, keywords you need to remember here is muffled heart sound. So if your client has a muffled heart sound, it only means letter C, cardiac tamponade. So remember that your cardiac tamponade has three main symptoms. Okay, one of these will be your muffled heart sound, muffled heart sound. Another one will be hypotension. There's decreased BP, and the third one will be distended neck vein. Distended neck vein. Okay, these three symptoms is what you call your Beck's triad. Beck's triad. Okay, this is a classic manifestation of cardiac tamponade. Next, number 2. Which of the following types of shock is associated with tamponade? Is it A, anaphylactic? Eliminate because this is due to or related to allergy. Eliminate D because this is associated with infection. So between B and C, best answer here is Boston because letter C is related to what? Bleeding. Okay, bleeding and dehydration. While your letter B, cardiogenic shock, this is a type of shock that is related to or caused by heart problems. And since cardiac tamponade is a heart problem, if this patient develops shock, it's termed as cardiogenic. Next, number 3. Which of the following diagnostic tests is used to detect cardiac tamponade? First, let's try to eliminate D because this will be the diagnostic if your client has heart failure. Eliminate C because if a client with cardiac tamponade will undergo ECG, the purpose of ECG is to rule out other possible heart problems. Okay, this is only to rule out other heart problem. Between A and B, best answer here is letter A because letter B, eliminate that. This is only effective in diagnosing what you call your pericardial effusion. Pericardial effusion is the term used to refer to a condition wherein there's a accumulation of fluid around the heart. While pericardial effusion may lead to cardiac tamponade is a condition wherein the heart is being compressed by the fluid that is surrounding the heart. So when you say simply as an accumulation alone, that's pericardial effusion. But if this fluid that accumulated starts to compress the heart, it's now termed as cardiac tamponade. And echocardiography cannot determine cardiac tamponade, but X-ray can. That's why A is the best answer. Next, number 4. Which of the following interventions or medication is the emergency treatment for cardiac tamponade? So we're looking for emergency treatment. First, let's try to eliminate letter C because this is only done if your client is has hypovolemic shock, okay, due to hemorrhage. But remember, the client has no hemorrhage. Client has cardiac tamponade. Okay. Next, eliminate B because dopamine is a medication that increases blood pressure and it has nothing to do with cardiac tamponade. So between A and D, best answer is Dallas. Pericardiocentesis is the aspiration of fluid around the heart. So remember that in cardiac tamponade, there is a fluid that accumulated around the heart that is compressing the heart. So if you aspirate that fluid, you will relieve the pressure and it can be an emergency treatment for cardiac tamponade. Surgery is considered if persistent conditions. For example, after pericardiocentesis, the cardiac develop again another cardiac tamponade, and then and so on and so forth. It seems that the cardiac tamponade is keeps on repeating itself. That's a time that surgery can be considered, but it's not an emergency treatment. So eliminate A. Best answer here is Dallas. Next, number 5. A nurse is teaching a 50-year-old client how to decrease risk factor for coronary artery disease. He is an executive who smokes, has a type A personality, hypertensive. Which of the following risk factor cannot be changed? Obviously, that's letter A. You cannot change your age. The rest are, these are all modifiable risk factors. Next. 6. A client says he's stressed, but he enjoyed the challenge. Which of the following suggestion is best to the client? A. Switch job position. Eliminate. Remember, the client is enjoying. Take spend more time with his family. Eliminate. Okay, this is not the issue. There was no family time problem mentioned, and there is no data indicating that the client is taking his work at home. Best answer, Boston. Take stress management class because this will help the client. Next, number 7. Which of the following nursing diagnosis is correctly worked? A. Anger related to terminal illness. B. Pain related to alteration in comfort. Eliminate this because pain is the same with alteration in comfort. C. Red sacrum related to improper positioning. Eliminate because when you're trying to make a nursing diagnosis, you need to avoid incriminating words. Okay? The word improper positioning is incriminating. It's as if you're trying to judge the nurses caring for the client that they are not properly positioning the patient. Between A and D, best answer, Dallas. Okay? Look at A. Anger related to terminal illness. Now, if anger used as a nursing diagnosis, remember that anger is not always the time a problem. Not always a problem, or it's not always a bad thing. Okay? Sometimes anger is a good thing, right? Sometimes anger is a normal response. So to say that anger as a or if you make anger as a nursing diagnosis, it's as if you're saying that anger is always a bad thing or always a abnormal response. No. Okay? Best answer here is that social isolation related to inability to speak because of laryngectomy. This is the best answer. Next, number 8. 28-year-old client with human immunodeficiency virus is admitted to the hospital with flu-like symptom, face dyspneic and cough. He was placed on 100% non-rebreather mask with ABG gases drawn. Which of the following results indicate the client needs to be intubated? Answer, Dallas. Why? Although all of them may not have a normal oxygen, that is not the parameter that you should look at, but the level of the carbon dioxide. As you can see, these three options has normal CO2. So the client can still remove carbon dioxide from the body. While letter D, there is now accumulation of CO2 which can lead to acidosis. And this will tell you that the client needs now to be intubated. Okay, Dallas the answer. The normal CO2 is between 35 to 45. Next, number 9. Which of the following substances most commonly transmit the immunodeficiency virus? Most common. Okay, transmission of the HIV virus is through body fluids, with the exception of two. There are two exempted body fluids. We have the saliva, which we can now eliminate C, and sweat. Okay. Between um, A, B, and D, A is the most common cause or most common method of transmission. Next, number 10. Which of the following opportunistic disease is caused by a protozoa in clients with acquired immunodeficiency syndrome? Is it A, tuberculosis? Remember, TB is bacteria. It's not a protozoa, so eliminate A. Next, histoplasmosis. Histoplasmosis is a fungi, so eliminate D. Between C and D, answer Dallas. Kaposi sarcoma is a form of cancer, not a bacteria, so eliminate C. While Pneumocystis carinii is a protozoa. Dallas is the answer. Next, number 11. Client with acquired immune deficiency syndrome is intubated, leaving him prone to skin breakdown from the endotracheal tube. Which of the following intervention is best to prevent this? Now remember that a client who is intubated is prone to skin breakdown around the mouth because of the tube. Remember that tube can press or can apply pressure around the mouth. So, as a recommendation by your books, you need to reposition the tube every 24 hours. That's why this is the answer. A, eliminate A because this is about cracking of the lips, not about it's not about skin breakdown. While B and C eliminated because this is about what? Oral care. And oral care is mainly due to prevent infection, not to prevent skin breakdown. That's what the answer here is. Dallas. Next, number 12. Which of the following medication is given with pentamidine isethionate to a client with AIDS for PCP? Answer here would be Boston. Cotrimoxazole is considered to be the drug of choice for your PCP. PCP stands for Pneumocystis carinii pneumonia. This one. This is your PCP. Okay? Drug of choice for that is cotrimoxazole. Next, number 13. A client receiving pentamidine isethionate should have which of the following parameters monitored frequently? Now, these drugs, please take note that this can cause diabetes mellitus. Therefore, you need to monitor blood sugar. Next, number 14. A nurse care for a client with AIDS is working with a nursing student. She notes that the student doesn't attempt to suction or assist with care of the client. Which of the following action is appropriate? So the nurse notices that the student is somewhat aloof to the client who have AIDS. Now, what should the nurse do? Answer here is letter A. You need to talk to the student to explore the feelings. Okay? Because you need to understand why the client or why is the student nurse behaving like that. Eliminate B, C, and D because these are not necessary or it's not needed for the nurse to do. A is the best answer. Next, number 15. A client's significant other is tearful over the client's condition and lack of improvement. He says he feels very powerless and unable to help his friend. Which of the following response by the nurse is best? A. Agree with the person. B. Tell him there's nothing he can do. C. State she understands how he must feel. Or D. Ask if he would like to have some comfort measures. So going back to the situation, the client or the significant other is tearful and because of the lack of improvement, and the client feels powerless and unable to help. So while reading this, you can see that the significant other is expressing a what? A willingness to help. Okay, so the significant other is expressing willingness to help. Now, what should you do? Is it A, argue with the person? Eliminate. B, tell him there's nothing he can do? Eliminate. Why? Because this is basically similar. Remember, client is willing to help. Therefore, although the condition may not be modifiable or it may be terminal, it doesn't mean that there's nothing you can do. Okay? So best answer here is Dallas. You ask if the significant other wants to provide comfort measures because comfort measures are still be able to be performed to these clients. Okay? And it will address the willingness to help. That's why D is the best answer. Next, number 16. A 31-year-old client is admitted to the hospital with respiratory failure. He is intubated in the emergency department, placed on 100% oxygen, is coughing up copious secretion. Which of the following intervention has a priority? Is it A, get an X-ray, B, suction the client, C, restrain the client, or D, obtain an ABG? First, let's try to eliminate letter C because there's no data indicating that the client needs to be restrained. And there's no need to get an X-ray because it was already mentioned that the client has respiratory failure. Best answer would be it's either Boston or Dallas. Although letter D is needed this is needed to evaluate the effectiveness of the oxygenation. Remember, the client is placed on a mechanical ventilator here. So if you want to find or if you want to evaluate the effectiveness of the mechanical ventilator, you need to check the ABG. But remember, it must mention that client has copious secretion. And copious secretion can provide an obstruction, which can decrease oxygen being delivered by the mechanical ventilator. Therefore, Boston should be your priority. And after Boston, you may now answer Dallas. But what's being asked here is which one is your priority. B is the answer. Next, 17. Client with endotracheal tube has copious and brown tinged sputum. Which of the following intervention is a priority? A. Use a trap to obtain specimen. B. Still saline to break up secretion. C. Culture the specimen with a culturette swab. Or D. Obtain an order for liquefying agent for the sputum. Now, let's eliminate B and D because they are the same. Instilling saline to break up the secretion is same with liquefying the secretions. Okay, so the answer should be between A and letter C. The answer here will be letter A. Use a trap to obtain a specimen. Okay, now there is no need for a culturing the specimen with a culturette swab because the client has endotracheal tube. So you let the client cup the specimen. Now, why do you need to study or obtain a specimen? Because the characteristic of the specimen is brown tinge. And if the specimen is a brown tinge, we all know that this will need further evaluation. Okay? A brown tinge sputum is suspicious. Okay? So if a sputum is suspicious, you need to evaluate it further. And for you to be able to evaluate it further, you need to obtain a sample. That's why A is the best answer. Next, number 18. An X-ray shows an endotracheal tube is 2 cm above the carina, and there are nodular lesion and patchy infiltrates in the upper lobe. Which of the following interpretation of the X-ray is accurate? A. X-ray is inconclusive. B. Client has a disease process going on. C. The endotracheal tube needs to be advanced. Or D. ET tube needs to be pulled back. Going back to the question, which of the following interpretation of the X-ray is accurate? If we will try to study this equation, if this is the endotracheal tube, according to the situation, this is 2 cm above the carina. Carina is the bifurcation of your left and right main bronchus. This is where your trachea divides into 2 bronchus. So that's the carina. Okay? Now, question is this an appropriate placement of the tube? The answer is yes. Therefore, there's no need to move the tube. Eliminate C and D. So, this should only be between A and B. Now, another assessment in this situation says that there's a nodular lesion in the X-ray. So, there are nodular lesions in the X-ray. This is obviously not normal because this will suggest tubercular or tuberculosis infection. Although X-ray is not conclusive, still there's a presence of infiltrates. Better answer would be a Boston, that there is a disease process going on. Now in letter B, you're not trying to conclude what type of disease, but you know that presence of this is not normal, therefore B is the answer. Next, number 19. A client has copious secretions. X-ray results indicate tuberculosis. Which of the following interventions should be performed first? A. Repeat X-ray. B. Tracheostomy. C. Bronchoscopy. Or D. ABG. Going back to this question, what intervention should be performed first if the client has secretion and X-ray results suggest TB? Is it repeat the X-ray? There's no need to repeat the X-ray. You will only repeat X-ray once the client started medicating and you want to evaluate the response of the client. Eliminate B because this is an airway support and there was no data mentioned in the situation that the client needs one. So between C and D, the answer here is letter C, bronchoscopy. Why? Because bronchoscopy can be or can have three functions. First, it can obtain secretion. Remember that the confirmatory test for X-ray is your acid fast bacilli, which you will be able to do by obtaining a specimen. Next, aside from obtaining a specimen, bronchoscopy can aid in diagnosing your tuberculosis. And through bronchoscopy, the doctor can clear secretions. So it's like hitting three birds in one stone. That's why letter C is the best answer. ABG, we check this if the client is suspected to be retaining carbon dioxide, which is basically on the late stage of any lung problem. So this will not be the first to be performed. Eliminate Dallas. And number 20, a nurse is aware that the family members of a client diagnosed with TB, as well as staff members, may have been exposed to the disease. A tuberculin skin test may show which of the following condition. So, family member is exposed to a client with TB, staff member of the hospital is exposed to a client who has TB, and to determine or to confirm exposure, we perform a test called tuberculin skin test. Now, tuberculin skin test will only tell you if the client has been exposed to the TB bacilli. It will not determine an active disease because active disease can be seen on X-ray or sputum exam. A recent infection, most probably, but the word recent means if you test positive for TB, it means you have just been cured with TB. No, because a client who have never had any TB disease at all can test positive for TB. Extent of infection, no. Again, this will be manifested by X-ray. Answer is Dallas. Infection at some point. Now, infection at some point can be considered a severe infection, a moderate infection, or just a mild infection, like what happens when you receive BCG. Okay, it's just a mild infection. There's the disease will not develop full blown. Okay, a mild infection only. That will be determined by your TB or your PPD, purified protein derivative, or MAN2 test, or tuberculin skin test. They're basically one and the same. So this is the end of this section. Looking forward to the next section. I hope you got high. Thank you and goodbye.